Magandang araw po sa inyong lahat, sa ating mga guests, our fellow classmates from Beacon Academy, the Beacon Academy parents, Ms. Ermita from Inichucan Elementary School, Ms. Alonda from Southville, the administrators of Beacon School, Ms. Che and Ms. Mary, and the rest. Welcome to our online COVID-19 webinar. This event was hosted, planned, and arranged by the Beacon Academy Class 2023. We're going to be your hosts for today. I'm Yancy Tavares, and this is Aaron Lambao. So bago po ang lahat, may we request you to stand up. Awitin po natin ang ating pambansang wika. Ilagay pong kanang kamay sa kaliwang dibdib at sabay-sabay nating awitin ang pambansang awit.
Okay, so quickly, just before we start, we'd like to ask everyone if we could just take a quick group photo to commemorate this moment. So if everyone could just turn their cams on, we'll be taking the screenshot here on Zoom. Okay, if everyone's ready, just smile for the cameras. And there, that should be good. So everyone can turn their cams off now. So as you may already know, the overall focus and purpose of this event is to discuss the COVID-19 virus with the aims of raising awareness on the topic of vaccines. There will also be a discussion regarding how these vaccines are going to be handled within the Philippines.
Thank you, Aaron. So before we start, may I call on Mrs. Patty Isidro, our INS teacher and MYP Services Action Coordinator, for the opening remarks.
Good morning. Thank you, Aaron and Yancy. Again, welcome to our webinar. This webinar is an endeavor of our grade 10 students as their services action for the subjects of individuals and societies and physical and health education. Services action is the core of the IB Middle Years program that aims to provide students the opportunity to apply their lessons on their chosen current issue. It is designed to aid their educational development by allowing them to demonstrate their knowledge and skills, and at the same time, present a feasible plan of action to the concerned community to foster a sense of reciprocity and belonging that ultimately aids in strengthening community ties. We have been discussing in class how nations are built, and one of the ways we talked about was that nations should take care of their citizenry. Hence, we present to you this COVID-19 vaccination in the Philippines webinar. On behalf of the Beacon Academy, I welcome you all and I hand you back to our capable hosts, Aaron and Yancy.
Well, thank you so much, Mrs. Isidro. And before we start, we'd just quickly like to remind everybody that this webinar will be recorded and posted on YouTube for everyone in the Beacon community to see. So as you may already know, we have a plethora of different guest speakers that have graciously agreed to be here to give their input on the topic of vaccines and COVID-19 as a whole.
Okay, so first off, we have Senator Francis Kiko Pangilinan. Senator Pangilinan is a Filipino lawyer and politician who has been serving the Philippines since 2016 after his previous terms from 2001 to 2013. From 2014 to 2015, Senator Pangilinan was appointed Presidential Assistant for Food Security and Agricultural Modernization. He has also held the title of Secretary in the Cabinet of President Benigno Aquino III. Senator Pangilinan is currently approaching his fifth year as a senator and as the president of the Liberal Party.
And before we start with our speakers, all questions that you may have will be addressed in the open panel occurring after all speakers are done. So make sure to hold on to your questions until then.
We'll now be handing over the floor to Senator Pangilinan.
Good morning, everyone. I'm happy to join you today in this webinar discussion about the COVID-19 vaccine. I hope by the end of this session, you will have a better understanding of the vaccine situation in the country, the importance in your lives and the lives of our people. It's indeed a privilege to be able to interact online with students of Beacon Academy. And I will not be surprised if along the way some of you will say or ask, I thought it was Kaki Pangilinan who will be talking today, not Kiko Pangilinan. But don't worry, I will try my best to speak to you as best as I can. And I'm sure many of you know my daughter more than you know me. But that's okay. Improvement of the race ang tawag nila ron. From news reports, we are seeing another surge in COVID-19. After over a year in lockdown, one of the world's longest, some are saying we are back to square one. Worse, according to former Health Secretary Esperanza Cabral, we are 10 steps back from square one. Daily cases have reached as high as 5,000 in a single day cases in March, and the highest in the last 7 months. The country's total active COVID cases rose to 61,733 just this past Wednesday, after the Department of Health reported an additional 4,387 cases. There are also reported cases of more infectious variants that might possibly contribute to the surge of cases. If daily cases continue to rise, our health care facilities may yet again be overwhelmed with a surge of COVID patients. We do not want this to happen, and that is why it is essential that government fast-tracks its vaccination program so that we can protect ourselves against the virus. In fact, last month, we in the Senate passed a measure setting up the COVID-19 vaccination program and speeding up the vaccine purchases and creating a 500 million peso indemnity fund. We co-authored this measure and it was later signed by the President as Republic Act 11525. Among others, this law allows local governments to purchase vaccines, related equipment and resources. It exempts towns, cities and provinces from the long procurement process under the procurement law. This means the purchases of vaccines will not rest entirely on the national government. Late last year, Secretary Charlie Galvez Jr. was appointed as Vaccine Czar, in charge of procurement, storage, negotiations, and distribution of the vaccines nationwide. But despite these Senate interventions and the appointment of an officer in charge of the vaccine rollout, a year after, we are still grappling with the virus. The difference between a year ago and now is that our health workers, our doctors, our nurses, like everyone else, are just very, very tired. I remember a social media post saying that this is the first time in history when an ordinary individual can save the human race by just staying at home. It's little to ask of us if we are to protect one another. Of course, we know we did more than the eat, study, sleep, repeat routine. Forced to stay home, we had to find a way to be more creative. We lent a hand in the kitchen. We became assistant plantitos or plantitas. We found new skills. We honed what we already know, and perhaps in many instances bonded more as a family. But there's the not so pleasant side of the reality that hounds millions of families in this pandemic. Jeepney drivers and informal sector workers like vendors who earn by the day suddenly could not provide adequate food on the table. Some even had to beg. Professionals who lost their jobs had to try making a living selling various items online. OFWs had to scrimp to stretch their savings up to the next employment. Are the vaccines our only hope? We all want the vaccine, but we want the dose that is safe and effective, one that did not take the shortcut but went through all safety and efficacy tests and processes of approval. Vaccinating the target of at least 60 million Filipinos comes at a hefty price, but has been given provisions in our budget. The government has in place a total of 82.5 billion pesos for vaccine procurement for around 55% of our population. Of this, 2.5 billion will come from the 2021 budget of the Department of Health, 10 billion from the funds allocated under Bayanihan 2 to Recover as One Act, which we passed last September, and the bulk of 70 billion will be sourced from loans that you and I and your parents will help pay through our taxes. There is also, as I said earlier, a 500 million peso indemnity fund that we pass through a separate law for those who will experience side effects after inoculation. This is why we have to keep an eye on how the Executive Department, through the National Task Force and the IATF, how they will spend the money. What will we be using to procure the vaccines, our people's money, and loans that we all have to pay later. Theoretically, what would be the best way to distribute the vaccine, especially in the remote areas? Constant communication and coordination between the national and local governments and the private sector are key in ensuring that vaccines are distributed properly and that the public can easily have access once available. We could also tap our armed forces and our Philippine National Police, utilize their resources, their equipment, their helicopters and other assets for faster delivery of vaccines, especially in remote areas. Where are we in the line of Filipinos who will get the vaccine? Of the 1,125,600 doses now available from Sinovac and AstraZeneca, over 200,000 medical health workers have been inoculated. The government aims to vaccinate over 1.7 million frontliners by mid-April. This government will begin inoculating the general public about the same month. But children below 18 years old will have to wait for the tests to find out if vaccines are safe for them too. Pediatric research requires a higher bar of safety for vaccines that will be administered to children. We acknowledge that we're not going to be able to control or manage the pandemic effectively until children are vaccinated as well. Until such time, the home would be your safest place of refuge against COVID-19. We will still have to wear masks, wash our hands repeatedly, and stay a safe distance from friends and other people. The contributions that you, our children, pitch in when following minimum health protocols will pay off in the long run. Trust that scientists are working round the clock. Health workers will not abandon the front lines and continue treating the sick, and public officials will continue making sound policies while at the same time being critical in demanding efficiency and accountability. This pandemic has made us better appreciate the contributions of our essential workers who help to keep our lives going. Our healthcare workers, contractors, security guards, F&B operators, transport workers, just to name a few. We must honor them for their work and accord them the dignity and respect they deserve. We've just crossed the one-year mark in our battle against COVID-19. The fight continues. Even as we continue to focus on the tasks at hand, we must look ahead to the goal of resetting the future so that we may emerge as a nation that is compassionate, equitable, green, efficient, and with a stronger spirit of solidarity and shared purpose. We want to see you, our young people, out in the world anew, chatting with friends, playing in the fields, experimenting in laboratories, exploring uncharted arenas. This time enriched with learnings not just from online classes, but from your own discernment that you're lucky and blessed and have a purpose in nation building to have survived the pandemic. When it's your turn to run this country in whatever capacity, private sector or government, do not forget the lessons learned from this pandemic and the values of goodness and knowledge taught by your school, our parents, so that generations before and after you will be assured that we are all in good hands. Pleasant good day to all of you. Maraming salamat.
Thank you so much, Senator, for the great speech. We'd like to remind the audience that now is the time to write down your questions for the open panel to come.
Maraming salamat po, Senator. Sa ating mga audience, kung mayroon po kayong mga tanong, isulat lamang at huwag niyo po itong kalimutan dahil tatanungin po namin ito sa ating mga bisita mamaya sa open panel. Maraming salamat po.
Next, let us introduce Dr. Armando Paez. He is an infectious disease specialist in Springfield, Massachusetts, with over 22 years of experience in the medical field. His subspecialties lie in general infectious diseases, HIV/AIDS medicine, as well as healthcare associated infections.
Please welcome Dr. Paez.
Hello, my name is Dr. Armando Paez. I'm the Chief of the Division of Infectious Diseases at Bay State Medical Center, UMass Medical School at Bay State in Springfield, Massachusetts. Kumusta po kayo dyan, mga kababayan? I'm delighted to give you this brief presentation on COVID-19 vaccines. I hope that I can give you useful information in order for you to understand the science behind COVID-19 vaccines. This is the outline of my presentation. I'm going to talk about SARS-CoV-2, the virus behind COVID-19, the concept of herd immunity, the variants, and of course, COVID-19 vaccines, and why you should get vaccinated. This is a diagram of SARS-CoV-2 and its different parts. I want you to pay particular attention to the spike glycoprotein, the numerous yellow mushroom-like structures just outside the virus. The spike glycoprotein interacts with the host cell, typically through a receptor called ACE2 receptor, allowing the virus to enter the host cell and cause infection. This is an important piece of information to understand because COVID-19 vaccines typically are designed to produce antibodies that will prevent this interaction to occur and thus preventing infection. When the virus infects the host, typically through inhalational route, it basically multiplies in the body, causing high levels of virus. And there is a period of pre-symptomatic phase, meaning before symptoms occur, typically 4 to 5 days after exposure. And those patients who will develop symptoms after that. Approximately 80% of them will develop mild to moderate symptoms, but some of them will develop more severe illness and be critically ill, and some of them will die as well. Now, it's very important to remember the different phases of the infection because there is a period where an antibody that is produced by the vaccine can interrupt this process by preventing the interaction of the spike protein with the host cell. Once the infection sets in, the body responds to the invading virus by innate immunity and directly killing it by various mechanisms. But in addition, there's also an adaptive immunity where the body learns from this experience and recruits different types of cells, the T cells and B cells, and create memory cells, so that when the body is exposed to the same virus, it can more effectively clear the infection. And this is the basis of vaccination. Behind the science of vaccination is the concept of herd immunity. So basically, it talks about the critical number of immune individuals in a certain group or population that can prevent effective transmission of these infection. And it is estimated that in COVID-19, you need approximately 60 to 72% of immune individuals to achieve the herd immunity, either by natural infection or vaccination. Vaccination activates the immune system by introducing foreign material to the body, and the body responds to this foreign material by producing antibodies or a T cell response that can directly kill the virus. This foreign material could be either a dead virus or inactivated virus, uh, a part of a virus, or a genetic code, either an RNA or a DNA that later on is encoded to a protein to which the body responds to and produce these antibodies and T cell response. So the vaccination allows the body to prepare for the real infection. I want to briefly mention about the coronavirus because it can affect vaccine efficacy and the behavioral pandemic in the future. So SARS-CoV-2 is an RNA virus, so it's composed of genetic codes that encodes these proteins. You can look at it as a house blueprint with the design of different house components, and the spike protein is the door design. And if you change or there's mutation in that, there's a change in door design and lock mechanism, it can, for example, be made of gold and no door lock and can attract more thieves. And similarly, with any mutation in the spike protein, it can increase transmissibility because it enhances interaction between the receptor and the spike protein. And thus, any change in the structure of this spike protein, the antibodies that have been produced by vaccines that are designed in a different way will not be effective in preventing this to happen. This is a partial list of COVID-19 vaccines that are in early use, and there are approximately 81 vaccine candidates that are in clinical development based on WHO as I speak. And depending on the vaccine types, there are varying reported efficacy rates on these from 50 to 95%. And there are also safety data on these vaccines. Uh, so why should you get vaccinated? I think that's a better way to protect you, your loved ones, and your community. Immunity from a natural infection can lead to deaths, and I don't think that's a way to go. I know trusting the vaccine development and approval process can be challenging, particularly during a pandemic, depending on the social situation and political climate. But I think the key is transparency in the process. That's where collaboration of scientists, policymakers, and government officials can occur. COVID-19 vaccine is a testament to the progress in science. Within a year, we do have not only one, but several effective vaccines against COVID-19. And lastly, you should get vaccinated because we know more about COVID-19 now than before. There are real world data on COVID-19 vaccines on safety and effectiveness, and I think we should really look at the science behind this. Again, thank you very much. Maraming salamat po sa pakikinig sa akin.
Well, thank you so much, Dr. Paez, for that very informative presentation.
On to our next guest, we have Congressman Mike Aglipay. Congressman Aglipay is a Filipino businessman and politician who has been serving as a congressman of the Philippines since 2019. Congressman Mike Aglipay is a part of the Committee of Rules and he approaches his second year at Congress.
Please welcome Congressman Aglibai.
Good morning, 10th grade students from the Beacon Academy, as well as to the teachers, staff, my fellow parents, and all other students who are viewing this live in Zoom. Let me greet also members of Inchan Elementary School and Laloma Elementary School, and who may be watching this on a slightly delayed basis via recording. Good day to you all. I'm honored to be invited in this webinar and to represent the Philippine government to talk about our COVID-19 response, particularly on the issues of vaccine distribution in our country. First, a short introduction of who I am and a bit of disclaimer to come with it. I'm Congressman Michael Edgar Aglipay, representative of DIVA Party List in the 18th Congress, serving also as Assistant Majority Leader and as Chairman of the House Committee on Good Government and Public Accountability, also known as the Blue Ribbon Committee. As my title suggests, I am not with DOH and the IATF, nor with any of the implementing agencies of government for COVID-19 vaccination. However, as a member of Congress representing the labor sector, I have the privilege of receiving primers, briefings, and pertinent information afforded to lawmakers to aid us in drafting legislation that would respond to our ongoing crisis, which enabled us to pass the two Bayanihan Wheel as One Acts. I also had the honor of having dinner and speaking extensively with Philippines COVID-19 vaccine czar and National COVID-19 Action Plan Chief Implementer Secretary Carlito Galvez Jr. as early as November last year. My sharing this morning is based on the discussion we had that evening, as well as other presentations and updates made to Congress in the past couple of months. Let my sharing begin with the end in mind. The goal of our COVID-19 national vaccination plan is to protect the public and reduce morbidity and mortality rates due to COVID-19 infection. We can achieve this by establishing a sustainable and fully integrated vaccine deployment and immunization program against COVID-19, adopting a whole of nation and the whole of society approach in collaboration with national government agencies, local government units, and the private sector. Ultimately, we'll be able to save more lives, pave the recovery of our economy, and restore normalcy in the lives of the Filipino people by 2023, having established a sustainable vaccination program for 2 to 5 years. There are five key considerations making this succeed. They are: 1. Safety and efficacy; 2. World supply and demand; 3. Cost and complexity of supply chain requirements; 4. Concept, selection, and distribution; and lastly, number 5, results of clinical trials. These five considerations affect the process of planning, preparation, and execution, which runs through a spectrum of activities ranging from diplomatic engagement for negotiation and contracting to supply chain, shipment, and storage, and all the way to the preparation of LGUs for distribution and deployment and waste management. The key is to ensure that there are people in place from top to bottom and that communication of accurate and right information is disseminated down the line. Where are we so far? If you follow the news coverages around us, you would have heard in the past 2 weeks, two shipments of COVID-19 vaccine has arrived in the country. We have received 600,000 doses of Sinovac vaccine and 525,600 doses of AstraZeneca vaccine. These 1.1 million doses have come from the COVAX facility of the World Health Organization. As of this week, through the DOH, with the assistance of the Philippine Coast Guard and the Philippine military, 90% of these vaccines have been deployed and they have been dispatched to areas as far as Batanes in northern Luzon and Tawi-Tawi in the southernmost area of Mindanao. The expectation is that the pace of deployment will pick up within the second quarter of the calendar year, where the bulk of an expected 148 million doses will arrive. By the end of the year, we should have at least 70 million Filipinos being vaccinated, and that accounts for 70% of the 100 million population. Knowing these now, the most common questions are, how do we make sure that we are able to procure enough vaccine? And secondly, how do we get access to these vaccines? First, let us establish the reality that there is a very limited global supply of vaccines in 2021. By end of this year, the most number of vaccines that can be produced given the manufacturing capacity of all vaccine makers already in phase 3 clinical trials is about 5.8 billion full regimen. The current world population is 7.8 billion. Hence, a projected shortfall of 2 billion people not being vaccinated by the year of this year is a clear reality. Our government's approach is to pool national volumes to get a seat at the negotiating table and secure the most vaccines at the best price. After all, centralized national procurement is the prevailing approach globally for both developed and developing markets. This is this has given way to the country's tripartite agreement, a first in the world innovation that allows a private sector and local government unit to procure vaccines in partnership with the national government. And this answers the first question as to how do we procure our vaccines. Our LGUs, the local government units, and the private sector provide funding for doses, paying directly to the manufacturers, with 50% of the procured doses donated to the national government. The national government secures the doses at the best price through negotiations with manufacturers, and the vaccine manufacturers are responsible for providing the number of vaccine doses at the price negotiated directly with the national government. This tripartite agreement and mechanism is seen as a vehicle to get us the best prices of vaccine and allow more supply. On the second question, how or when do we get access to these vaccines? The answer to this question lies on the National Immunization Program prioritization. As you may know, there are sectors of the country that are more at risk in contracting the disease, and they are those less at risk. Using this risk assessment scale, the program has defined the priority sectors who will be given priority access. They are as follows. First priority, the frontline health workers. Second priority, indigent senior citizens. Third priority, remaining senior citizens. Fourth priority, remaining indigent population. Fifth priority, national personnel, PNP, AFP, Philippine Coast Guard, Bureau of Fire, and other uniformed services. After deployment to these priority sectors, the order of prioritization will be as follows. Teachers and social workers, government workers, essential workers outside health, education, and social welfare, such as agriculture, industry, and transport and tourism, followed by socio-demographic groups, significantly higher risk, such as persons with disabilities and Filipinos living in high-density areas. And lastly, and then our OFWs, then the remaining workforce, and finally, all remaining Filipino citizens. This week, we remember the beginnings of this global pandemic called COVID-19, our first year anniversary for the lockdown, and how in the past 1 year, our way of life has been greatly disrupted, and our perspective of things changed in ways we could not have previously imagined. Our faith in God and our belief in the perseverance of human spirit told us this too shall pass. Today, our dear students, with vaccines being produced at historically record speed, the peoples of the world learning to work together even while apart, we are in a greater position to declare that truly this too shall pass. I encourage you to keep on praying, keep on believing, and keep doing your part by following minimum health protocols. Wash your hands frequently, wear a mask when you leave your house, keep at least 2 meters distance from others, and soon it will be our turn to get the vaccine. and we will be able to connect physically with our friends and loved ones once again. Thank you and good morning.
Thank you very much for your speech, Congressman Aglibai, for your insightful inputs on this subject.
For our last speaker, we have Dr. Jason Lagott. Dr. Lagott is an international communication specialist and a public health doctor. He is committed to social good through strategic communications, health promotion, and social science research.
Dr. Ligot, the stage is yours.
Good morning, and thank you to the Beacon School for the invitation to join you in this forum and have a conversation about a very important topic, vaccines and COVID-19. My name is Dr. Jason Lagott. I'm a public health physician and health promotion specialist. The COVID-19 pandemic is the most disruptive threat to public health in over a century. As of this recording, there have been over 119 million confirmed cases of COVID-19, including, unfortunately, over 2 million deaths globally reported to the World Health Organization. In the Philippines, there have been 631,320 confirmed cases of COVID-19, including 12,848 deaths reported to the DOH as of March 17. Now, what is the role of vaccines in responding to the COVID-19 pandemic? Vaccination is a safe and effective public health intervention that saves millions of lives every year. Many diseases that used to impact the health of millions are now under control thanks to vaccines. These include smallpox, measles, polio, and the seasonal flu. Vaccines work by stimulating the body's own immune system to create antibodies that defend against disease. It also benefits communities by contributing to herd immunity, where the benefit and protection from vaccines is shared. Herd immunity is achieved when a critical mass of the population, around 70%, possesses antibodies against an infectious disease, thereby conferring indirect protection even to those who are not yet vaccinated. When combined with testing, contact tracing, and preventive measures such as quarantine and isolation, mask wearing, frequent hand washing, and physical distancing, vaccination is critical to bringing pandemic under control. How are vaccines developed, and what is the state of COVID-19 vaccine development? Vaccine development involves extensive and rigorous testing before a candidate vaccine is approved for use in the population. In general, there are three approaches to developing a vaccine. The first involves using a whole virus that has been inactivated or weakened or attenuated, or using a whole but safe virus to deliver specific parts of the target virus as a vehicle to trigger an immune response. The second approach only uses specific parts of the virus, such as its proteins, to trigger the immune response. And finally, the third approach uses genetic material, or your mRNA, to deliver instructions for the production of proteins that the immune system will recognize and respond to. After a vaccine is designed in a laboratory, it is first tested in animals to evaluate safety and potential efficacy. Only after animal testing do clinical trials among humans commence. These clinical trials proceed in three phases. The first phase, the vaccine is given to a small number of volunteers to assess safety, confirm it generates an immune response, and determine the right dose. The second phase, the vaccine is given to a larger group of people to monitor for side effects and again confirm its ability to stimulate an immune response. Comparisons between groups who were provided the vaccine versus groups who were not provided may also be carried out at this stage. And finally, the third phase is when the vaccine is given to a statistically significant number of people who are monitored over time to determine its efficacy or its ability to prevent disease and gather further data on safety and any adverse effects. Only after a vaccine completes its clinical trials is the data subjected to further expert review to determine efficacy, safety, and manufacturing requirements before it is approved by relevant public health authorities such as the FDA for introduction through a national vaccination program. Once it's introduced, The monitoring of potential adverse effects is carried out through active surveillance to further assess safety and efficacy. The WHO recommends a minimum efficacy of 50% during clinical trials for a vaccine to be considered viable. This standard is set against the urgency of the current situation where COVID-19 continues to infect thousands of people every day. The important takeaway here is any vaccine that is approved by the FDA has gone through a rigorous process of evaluation and is therefore safe and effective regardless of brand or manufacturer. At the moment, there are over 200 candidate COVID-19 vaccines in development. About 173 are in preclinical development and 64 in clinical development, with clinical trials currently going on. As more vaccines are approved for use, the supply and options made available will also increase. The scale and demand for COVID-19 vaccines is unprecedented. When completed, it will be the largest vaccination drive in the history of public health. Current consensus indicates sometime in the middle of this year to early 2022 before a vaccine is widely available, and it may take another year before a significant proportion of the global population is vaccinated. Coordination across different programs and between health and non-health sectors will be key in order to reach all of the target populations and facilitate rapid scale-up and deployment. This includes all of us here today. As a final note, a few days ago, the DOH logged the single highest increase in COVID-19 cases in 2021 so far, at over 5,000, and it is possible that this number will continue to climb over the coming days. In light of the current surge and seeing that it's been over a year since the pandemic started, is there anything more or new we can do? Absolutely. One, share. If you have been applying all the measures consistently in your daily life, thank you and good job. It takes effort to build new habits. Share practical tips with others on how to keep safe at home, at work, and outside, such as organizing forums like this. Two, beware. It is nothing short of a miracle that we did not witness this surge during the holidays. That has given us a false sense of security. Now is the time to rethink plans from local trips to small dinner parties. When assessing risk, it is about location, home is better, proximity, more is better, and time, less is better. Third, prepare. Vaccines are here, but we don't have enough for everyone yet. That doesn't mean we can't prepare. Find out about your LGU or company's vaccine plan and sign up. This is part of our shared accountability. When the time comes, and it will, you want to be on that list. Four, and last, care. This surge can make people feel anxious and frustrated. These are normal reactions. A little kindness, flexibility, and self awareness goes a long way. We are still in this together. Stay safe, and yes, for the nth time, wear a mask, wash your hands, maintain physical distancing, and stay at home. Thank you, and I look forward to this morning's discussion.
Thank you for your speech, Dr. Ligot, for your expert medical inputs on this topic of vaccines and COVID 19.
Thank you so much to all of the speakers for their great remarks. We'll now be moving on to the open panel section. We'll be starting with the questions we have prepared for our speakers, then transition into the audience Q&A. So feel free to start sending in your questions into the chat box. And also feel free to send up follow-up questions during the open panel section.
Maraming salamat po sa ating mga speakers. Sa audience, maaari nyo na pong ipadala sa amin ang inyong mga tanong upang maitanong namin ang mga ito sa ating mga speakers sa pamamagitan ng paglagay sa chat box.
If we could ask our panelists/speakers to turn on their cameras and reintroduce themselves to the audience, that'd be great.
Okay, good morning, Dr. Ligot, Dr. Paez, Congressman Aglipay, and Senator Pangilinan. I hope you are all doing well today. Okay, so to start off our Q&A, we just wanted to know, have any of you been vaccinated? If so, which vaccine did you get? And if not, what are your plans moving forward?
Maybe yeah, I haven't been vaccinated. None of us in the family has been vaccinated. There is a protocol and the priority vaccination listing, and obviously we are not in the priority list for the first vaccinations in terms of the rollout. But in terms of whether I will be vaccinated or not, I intend to be vaccinated, and that decision will be guided precisely by seeking advice from the professionals. My youngest sister, whose kids went to Beacon School, all four of them, is a doctor, and therefore I will seek her advice as to which of the various available vaccines are safe, and I will follow her advice. Doctors have a sworn duty to do no harm, to protect, and most certainly my sister will not give me advice that would place me in harm's way. So we have to look at the science and be guided by the science, not by uh, you know posts on Facebook or Instagram or Twitter talking about whatever. Many actually, a lot of disinformation is happening in the middle of this pandemic, and it's very unfortunate. And so, to be able to be guided effectively and not be misled into misinformation or disinformation, let's seek the advice of our health professionals, our doctors, the experts.
Thank you very much for that, Senator. So the doctors, Congressman, would you like to add your inputs?
Uh, in our household, nobody has been vaccinated. To echo what Senator Pangilinan said, we are not in the priority list. However, in the House of Representatives, there is a scheduled mass vaccination by the end of May using AstraZeneca. So we will avail of that.
Thank you, Congressman.
Yeah, this is Dr. Paez. Well, before anything else, I'd like to congratulate the 10th graders here. You're doing a wonderful job. I'm really impressed with this webinar so far. And also would like to greet Iyo, who's also a student there, who's my inaanak, Iyo Dulio. So I work and live here in the United States, and I have received the Pfizer vaccine, and I was one of those very first ones who have received the vaccination. During that time, everyone was so nervous about the side effects and what they found in the clinical trials are actually what is being experienced in the real world. Most common symptoms is just pain in the injection site, which lasts about 1 to 2 days. Some headache, some mild fever for some of these some of the individuals who have received the vaccine. And the second dose, typically after the second dose, there are more symptoms than the first one. But as I always tell my patients, you should compare the vaccine to the disease, not to another vaccine, because vaccine will offer you protection. What symptoms that people experience after vaccination are expected, what we call reactogenicity symptoms, meaning the immune system waking up and trying to react to the antigens that will allow antibody production.
Thank you.
Thank you for that question. And yes, I'd like to echo the statement of Dr. Paez. Congratulations to the Beacon Academy students. I think this is really a wonderful initiative. And I hope that other schools and your peers can learn from your project today so that we can have more conversations like this. I actually just got my first vaccine shot yesterday. I received an AstraZeneca shot, and like Dr. Paez said, today, this morning, my right arm is still a little sore from the vaccine shot. I did experience a mild fever early this morning, and I just took some paracetamol to get me through it. And yes, I do. I know. I think one of the frustrating things about waiting for the vaccine is just the uncertainty around the time. And just like to remind everyone that, as mentioned by Senator Pangilinan and Congressman Aglipay, I feel that government is doing the best that it can to procure vaccines, enough for everyone. But that doesn't mean that we should just wait. There are many things we can do to prepare. Finding out, for example, how vaccines will be distributed and where you live, getting people to have these conversations about vaccines so that we can allay any concerns or fears. These are very important steps so that when the vaccine does arrive, and it will eventually, everyone is ready, prepared, and excited to get the shot.
Thank you very much, Dr. Ligot, and everyone else for your inputs on the question. Aaron?
Yep. So our next question is more directed towards Senator Pangilinan and Congressman Aglipai. So we're just wondering, could you elaborate on the government's plans to regulate the public and to prevent the amount of unnecessary individuals going outside? How is the government planning on controlling the public and regulating cases while distributing the vaccine?
Maybe Kong Mike can start. I can follow. I was
Hello,
first earlier,
thank you,
so I
Mr.
will.
Dr. Limiting movement is what we experienced during the March, April, and May lockdowns, the enhanced community quarantine. The government has balance between opening the economy and limiting movement. As of now, the government, I think, is leading towards strictly enforcing the general community quarantine, which is the level we are in right now. However, that they are considering further tightening in terms of people movement in the private sector and the government offices. So that is the latest I've heard so far.
Um, if I may add, I think the emphasis now compared to how it was earlier is on a more granular local quarantining, whether it's the barangay level or a district level or a city level, rather than, if you will recall, the first lockdown in March last year was Luzon-wide. So that was then. I think the approach now is more local specific, which I think is more effective because, for example, a NCR-wide lockdown or quarantining does not recognize that some areas like Las Piñas, for example, does not have as much cases as Manila. So you may lock down certain barangays in Manila, the city of Manila, but not necessarily the entire city itself. So I think that's the approach that's being undertaken by the national government and the IATF. And I support that. I think local governments have a better grasp of what's happening on the ground. They just need to be given the authority. They just need to be given the capacity, enable them to be able to, and support them, provide them the necessary resources such as PPEs, more testing kits, and yes, provide them with the vaccines so that they can, as deputized by the Department of Health, speed up the rollout. In the end, there is a saying that a war can only be won by ground troops, and no amount of air war, can subdue or defeat the enemy without the rollout of the troops on the ground. And so the local governments, I would like to think, are the troops on the ground. Perhaps also a portion of the private sector. Health centers, hospitals can also be part of that infantry needed to succeed in a rollout of the vaccines and to achieve herd immunity. And one more point, while quarantining is effective, I think it has to be complemented with precisely an effective vaccine rollout, number one, and two, continuous contact tracing, continuous testing, and of course, isolation. These are the lessons that we can draw from the successful management of the spread of the disease in, for example, countries like Taiwan, South Korea, New Zealand. In other words, if the other countries can do it, there's no reason why we should not be able to step up and do it as well.
If I may talk as well, thank you very much, Senator Kiko. I also would like for also the Philippines to kind of consider some strategies like what UK has done in terms of getting the first vaccine dose to the public as much as possible. In the past, it's been questioned in terms of that strategy, but I think we have more data now to support that with the higher effectiveness, real world data, even after the first dose. And that may help curbing the tide, because it looks like there's really a surge that is happening right now. And I think that is being considered, if not considered already.
As sort of a follow-up to that question, we are wondering, how can we be assured that the people that live in remote areas of the Philippines can be assured that they'll be able to get the vaccine as well?
Well,
As you can see from, go ahead, Senator.
no, go ahead, Mike. Go ahead, Kong. Go ahead.
As you can see from the initial distribution for the frontliners, the medical practitioners, it was evenly distributed throughout the country, from the northern part of Luzon through the southern tip of Mindanao. So we could expect the same thing when it runs through the priority list. It will not only be focused on those who are hardest hit, like NCR, Region 4, Region 7, and Region 12. It will not be like that. It will be distributed evenly so that the whole country is covered.
Yes. Well, the plan of government is to set up 4,125 vaccination centers throughout the country. So part of that, obviously, would be vaccination centers that would be accessible to precisely these remote areas. So that is the strategy. Establish 4,125, if I'm not mistaken, vaccination centers, both government and private sector vaccination centers, hospitals, health centers, and so that's the plan. Right now, if I'm not mistaken, about 1,000 have already been set up, which means they have to fast track setting up more of these vaccination centers. And I also understand that the mass vaccination will be sometime end of April, and as mentioned earlier by Congressman Mike, around May. So by that time, you should have operating throughout the country the 4,100 plus vaccination centers.
Okay, great. So Fianci, on move on to the next question.
Okay, so this question is addressed to our doctors. So, if I may ask, how effective are the current vaccines with regards to the new virus mutations? So, like, what differences do the various vaccines have? Are there any slight differences per brand?
Dr. Ligot, do you want me to take this one first?
Yes, please go ahead, Doctor.
All right. So it's a very loaded question. As you know, there are several vaccines that are being developed, but there are ones who are actually being used right now. Um, and as related to my presentation, the most commonly used ones right now have been in the Philippines. Now is being used the CoronaVac, which is by from Sinovac. And then I heard that Gamaleya, the Sputnik 5, was just approved by FDA or authorized by FDA to be used. And the AstraZeneca, which I think be given some doses already. And Pfizer has been authorized by the Philippine FDA, but I believe it's not yet the doses have not been available yet. So based on the variant, so it's very humbling because originally the original strain has mutated in the course of the year. The first one's the UK variant called the B117. This has a mutation that allows really easy transmissibility of the virus, but there is a mutation called the E484 and 417 mutations that are common among the South African and the Brazil variants. And I was reading about the P3, which is the Philippine variant. That is the third generation of the original P1 variant. And hence, these two mutations that I mentioned, they have ability to escape the immune system. So there could be an escape mutants, basically, of these variants. So the vaccines may not be effective. Not very effective, but will still offer some protection. And more recently, there's been data published. The AstraZeneca is only about 10% effective in mild to moderate infection, but still can prevent severe infection among the younger population. So that's just one example, AstraZeneca, and some of the vaccines that are being used, even for Sinovac, the data have not been, or they were late in presenting this data on a peer-reviewed process. So it's difficult to make any comment in terms of that. And because of the different platforms of the vaccines, it's really difficult to make a head-to-head comparison. But having said that, all these vaccines that have been authorized by Philippine FDA, as well as I know from the law or the way they do this, is that the Philippine FDA will not authorize it without these vaccines being authorized from the country of origin. So it has really gone through a rigorous process, and I think the important thing is trusting the process. That's the only way to do this, and being transparent in the process. That's the way for us to say that this is safe and effective enough to be used and really give important and accurate information.
Just to quickly add, totally echo Dr. Paez's position about trusting the process. I know, again, because it's a process being carried out by other people, and sometimes it can be very difficult to understand because of the scientific jargon, that for many of us, myself included, it's difficult to understand really what's going on and how the evidence is being appraised. One thing I would say, though, I think an important takeaway for all of us is that even if you receive a vaccine, whichever vaccine you decide to inoculate yourself with, that does not excuse any of us from not wearing masks anymore, not practicing physical distancing, or washing our hands frequently. The vaccine will prevent you from getting symptoms if you get infected from COVID-19. However, that doesn't mean to say that it will stop you from getting COVID-19 in the first place. And the data on whether it will prevent transmission is still early, so we can't really say whether or not once you receive a vaccine that if you get infected with COVID that you can't pass it on. So I think the message, at least at this phase where there's still a lot of research going on, is that yes, find out as much as you can about all the different vaccine options out there and make an informed decision for yourself and your family. But at the same time, we have to really continue practicing those minimum public health measures because it's only in combination, as Senator Pangilinan mentioned in his remarks earlier, that we can find a way out of this pandemic. Vaccines in itself will not solve the problem, but it's an important tool that we have. And it's only in combining all of these different tools that we know work will we see a pandemic-free future.
Thank you very much, doctors, for your inputs on this. Aaron?
Yeah, so on the topic of vaccines, we were just wondering what are common misconceptions about vaccines and what are the plans of the government to allay these fears and disseminate the correct information to the public?
Yes, that's a good question because the poll, the social weather station poll of I think December last year, pegged the question was, are you willing to be vaccinated? And 47% said no. And that's a huge number. I think that the Dengbaxia controversy, which was played out, tri-media, hearings, etc., really created a trauma of sorts amongst the public regarding vaccinations. And so, yes, and we raised this during the Committee of the Whole hearing on vaccination rollout. How do you intend? There has to be a no-nonsense information dissemination campaign to allay fears regarding the vaccines. And it doesn't help, I said this, that some in the government, there has to be message discipline, let's put it that way. And I think the experts should be the ones to speak on the efficacy and the safety of these vaccines, rather than officials who are not experts. It doesn't help, for example, that you say whatever vaccine is there, you have no choice, you have to accept it. I mean, that doesn't help in giving confidence. Ano ba naman yung sabihin, instead of saying it that way, why not say we are assured by the FDA that any of the vaccines that have been approved are safe and are effective. I think that's how it should be. So government must, I was joking, government must have a chat group so that they can ensure that there is a clear, categorical, information dissemination, and everybody is on the same page. It will also help, as has been done in other countries, wherein you have, the Prime Minister of Singapore or the President of Singapore, Prime Minister of Israel, Joe Biden, of the President of the United States, all being, publicly vaccinated. That too will help. In the Philippine setting, many of the citizens have, trust their local officials, for example, the mayors. In fact, the polls will show that up to 70% is the approval rating of local officials. So that too would help, in terms of showing the public that it is safe, that a selected number of, officials should set the example. And of course, Queen Elizabeth was vaccinated, and many others. So you just have to say that I don't think these presidents or these prime ministers will have themselves inoculated with a vaccine that will kill them. So that will create, more confidence among our citizens.
This is Dr. Paez. So there are three things that are commonly asked to me with regards to the COVID-19 vaccines. And the very first thing that they will ask is how come this COVID-19 vaccine has been fast-tracked in terms of approval? Did it compromise safety and efficacy studies? So if if the country or the whole world put all the resources and share information, we will really make progress in science. And this is a testament of progress in science. There's been a breakthrough with some of the technology in vaccine platforms, and primarily the mRNA vaccines. And they didn't really compromise, in general, they didn't really compromise the vaccine development process. It was just facilitated with some risk in the financial sector, meaning to say that they started purchasing or manufacturing these vaccines even before the studies have been completed. So meaning to say that it just so happened that they believed that on the technology that turned out to be really a good risk to take, and it turned out to be successful. And hence the production was really cut down to a very short span of time. So that's number one. A common misconception that, they just didn't really study it very well. Many of these vaccines that are now authorized have been studied really very well with vaccine efficacy and safety studies. The second thing that I want to mention that's very common among vaccines are, vaccine can cause the illness, because many of the reactogenicity, what we call the vaccine reactions, which are very mild, in 80% of the time, people will say, oh, that's the COVID-19. So vaccine doesn't really cause COVID-19 because it is, as I mentioned, it uses part of the virus or a dead virus, or a genetic, element that can produce an antigen that will elicit antibody response and T cell response, which is basically the immunity. So it cannot really, vaccine cannot cause COVID-19. And the third one that has been in the media lately is which I want to kind of mention, is the use of fetal cell lines that have been in controversy. There's a lot of discussions, and some of these vaccines have used some of the fetal cell lines from of fetal origin many decades ago. And these are immortal cell lines that are commonly used in research and have been used in testing few of these vaccines. And one is being used in production, but they're not directly from an aborted fetus. It is basically a cell line that was 1,000 generations from the original cell line many decades ago. So those are just three common things I want to mention. I don't know with Dr. Ligot if you have anything else you want to add.
No, just quickly, one point. I think because of the specific like vaccines like Pfizer and Dr. Paez said earlier that the way this vaccine works is that it delivers instructions through your mRNA. There was a news article, not really a news article, but an article that was not very reputable that went around. It was passed on to me several times that there are fears that it may alter your own DNA. So I don't really know where and how this information came about, but let me reassure everyone here that no, if you do receive the Pfizer vaccine or any of the mRNA candidate vaccines, it will not change your mRNA. It does not work that way. These are really just instructions that will allow your body to develop certain proteins that your immune system will react to. So so that kind of unsafe information really just got out of hand. So I think hopefully you can help spread the word that if and when Pfizer does arrive here, that is not one of the concerns. Thank you.
Yeah, so let me just add to that. Thank you very much for bringing that up. So the mRNA, as you know, Pfizer requires really super freezing temperature. That's the reason why it requires that, because the mRNA is very unstable. So once injected to the body, they disintegrate rather quickly. So there's no way that it's actually incorporated to any of the genetic elements in the cell. So there's no fear of any gene editing or infusion of this genetic material to the body. So they easily disintegrate in the system.
if I may just add very quickly, Dr. Ligot said something about information that's being passed around. I think we all should be very vigilant that we do not so easily pass around information that we receive unless we verify it or validate it. I have we have a family Viber thread, and we share information in that thread, and we are, some point we start, well, not naman, but nearly debating intensely that this information is unfounded, it's baseless, it's fake news, etc. So we should all be very vigilant as to how we are to respond to, react to, or how do you call it, digest information that's being relayed to us. We have to be vigilant and not just believe whatever it is that's shared to us. And again, it's a good thing in the family we have a doctor, my sister, as I said earlier, and immediately we ask her, what do you think? Do you think this is it? And therefore, really, we have to be vigilant in terms of the information that's going around, because indeed there is a lot of disinformation and misinformation happening. The difference between disinformation and misinformation is that disinformation is, it's been said, is deliberate. Someone is actually spreading lies or false information. Misinformation includes you and me. If we unintentionally spread this disinformation, then we are involved in misinformation, because unwittingly we are spreading information that we have not been able to validate. So we should guard against both disinformation and misinformation.
I'd like to add to what Senator Pangilinan said earlier. I was in the province in Tarlac last Sunday, and the mayor beside me asked around a crowd of 400 people, who among you would want to be vaccinated? And of the 400 people, only about 5 raised their hand. So I think my personal assessment, if we allow the local government officials, the mayor, vice mayor, and the barangay captains to get prioritized towards the end of this year, so that when the people see that their leaders are vaccinated, they would change their minds, because they want some sort of assurance that those above them will be show no untoward effects, side effects. So I think that's one of the best, if not the best, way of alluring the payers, especially those people in the provinces, in the rural areas.
Let me just chime in quickly. I think I totally support what has been said about, while we're waiting for the vaccines, it's so important for us to prime the community so that they will accept the vaccines when they arrive. One common, I would say, misconception about public health risk communication is that if you say something, people will just automatically believe you. That's just not the way the dynamic has changed. There are just so many sources of information right now, both good and bad. So my advice to anyone, including our very talented students here today, is that if you were to mount your own COVID-19 vaccine campaign, promotion, activity, or whatever you decide to do, is first to ask, ask people, why is it that they are hesitant? And you'll be surprised to know that there are many different reasons why people choose not to get themselves vaccinated. And by doing so, by asking first before, telling them just listen to the experts, just follow advice, then you start to have a conversation and a dialogue. And it's only when we have a genuine dialogue that people feel reassured that government and other public health organizations are acting in their best interest, and then they can participate and have agency.
And let me add to that too, like in a personal conversation with somebody who is not a believer of vaccine or has some real questions, I think it's very important to really keep an open mind and basically say to that individual that, okay, I'm listening, let me hear what you're saying, and try to find a common ground uh, towards a healthy, for example, a healthy lifestyle or good health. And from there, you kind of work yourself out and talking to how can we both reach that goal of having a COVID-19 free, life. So, and again, it's not just one conversation, it's multiple conversations towards that goal. So don't give up.
Well, thanks to everyone for their great inputs on that question. Yancy?
Okay, so I know this is a bit of a curve, but I believe that earlier Miss Patty said that this services action was a collaboration between the subjects, individuals, and societies and PE. So going on the route of say physical aspects and lifestyle, how important is like maintaining our physical health and fitness in regards to protecting ourselves against COVID? So I believe the
So
doctors will answer this question.
yeah, maybe I can
Okay.
start, and I'll ask my colleague to add any other inputs. But it's certainly very important to maintain a healthy lifestyle. I think more than anything, it helps build your definitely to help build your immune system, your resistance not just to COVID-19 but to other infections. At the same time, we know that physical activity also benefits your mental health as well. And that's a conversation that more and more people are having nowadays. COVID 19 has obviously disrupted our lives in many, many different ways. And that has resulted in a lot of mental distress. People are anxious, some are afraid, and some have very real concerns in their lives that can lead them to depression or other serious mental health conditions. So, maintaining a healthy lifestyle, eating right, moving more, avoiding alcohol, don't smoke. All of these have a net positive effect on your life, not just physically but mentally as well. So I thank you for bringing that up because I think that's a point that we don't also emphasize enough. Even though we're staying at home or working from home or whatever your personal circumstances are, there are still many ways we can keep ourselves healthy, both mentally and physically.
I don't really have anything much more to add, but I guess instead of saying social distancing is probably a better term for that is physical distancing. So we can still be socially connected, you know, despite the fact that we're physically distant from each other. So I think, that highlights the fact that, we are social beings. And I think that's very important, having an outlet and still being able to communicate with each other is very important in this pandemic.
Thank
Great.
you, doctors.
So, yeah, well, now we're going to transition into the audience Q&A. So these are questions we've gathered from the audience. They've been sending messages throughout this whole talk. So, Yancy, if you want to start with the first one.
Yeah. Okay. What protect? A person in the audience asked, "What protection do we have if we only get the first dose and not the second dose?" Parenthesis within ideal interval due to supply. If someone gets the first dose of a vaccine but not the second dose, will the person still be protected?
I can answer that question.
Yes.
Yeah, so actually this has been looked at. It's a very good question. So AstraZeneca actually just published their own data. Actually, yeah, they they found that first dose of the AstraZeneca is about 76% efficacious, and if you give the second dose at 12 weeks, you can even reach as high as 86% of efficacy. So there is a benefit of getting the first dose, even for other vaccine platforms like Moderna and Pfizer. It's about 50 to 60%. So that's hovering around that number. The question really is how long it will last, and that's the question. If you don't get the second dose because of vaccine supply, what is the way they roll this out is based on the clinical trial that they conducted, because that's the only way they can assure the public that You can get the 95%, for example, for the Pfizer if you follow the schedule. But having said that, they haven't really looked at the varying intervals that may actually be useful in a pandemic. For example, if they can use the first dose and do the second dose at 6 weeks. So it will offer some protection to the point that it hovers about 50 to 75%, but we don't know for how long it's going to last. And that's the main issue about just having the first dose.
Right, and to add to that, and I apologize if I keep repeating this, but really, I think people need to take this to heart. Whether or not you receive a first dose or a second and complete the full vaccine schedule, we really have to stay vigilant still. So, as Dr. Paez said, there is evidence to show that you do get some protection, which is better than none, but we don't know how long it will last. Which means to say that even if after you received your COVID-19 vaccine, you still really need to continue to wear your mask, to practice physical, not social distancing, as my colleague said. Stay at home when you can, and really just practice, integrate all of these healthy habits into your lifestyle.
Let me just another comment on that. Having said those efficacy numbers, again, the variants are trying to screw everything up in terms of all these numbers because of this. The B1351, the South African variant, really has this immune escape that affects efficacy of monoclonal antibodies, even the natural antibodies after an infection. And unfortunately, these variants are becoming more and more common. The UK variant, which is more widespread, doesn't have that trait, but the South African and the Brazil variants, and even the Philippine variant, the P3, which is a third generation lineage of that, do have those mutations that unfortunately can affect vaccine efficacy and even allow reinfection because the natural antibody production may not prevent reinfection with those variants. And hence, you should still practice those public health measures that will prevent viral replication because mutations are common among RNA viruses. They're not as common as influenza, but there is a problem with the way the virus replicates. It's error prone, and the way it survives is that it selects these mutations that have survival advantage, so it becomes a dominant variant in a certain population. But once you stop viral replication, the mutated virus actually will die off and will not be able to be transmitted to another person. So it's very critical. Vaccine is just one layer of protection. Actually, and we know this for the past year, social physical distancing and washing your hands and face masking are very important to stop the transmission.
Okay. Thank you, doctors, for this inputs. No? Okay. So, to follow up on what you've been saying, and like the question asked, is it possible to get vaccines from, say, two different manufacturers, as in multiple sets of two-dose vaccines?
I can also answer that question. So, the answer is that boosting it with another vaccine is not generally recommended because it's not been studied. Having said that, there's no real biologic reason as of now to say that it will not be allowed. Meaning to say that if you've got the vaccine now, that at the end of the year, that you will not be allowed to get a different type of vaccines. As you well know, in other types of vaccines, you have received different brands of vaccines and they're just fine. Now, of course, this is an evolving science, and you heard about, for example, the blood clots recently, related to AstraZeneca, and the European, agency have weighed in and kind of look at, the benefits still outweighs the risk. but there's some signal in terms of some subset of population that yes, there's some risk in having that, but it's very, very small group of population. We don't know yet what factors play a role in that, and that's still being studied. So again, we may get surprises with all of this, but at this point, what you get now in terms of vaccine, are you allowed to get another one, a different one at the end of the year? My answer at this point is there's no reason why not. And again, the data are still coming if mixing vaccine platforms later on will be helpful or not helpful or contraindicated.
Well, thank you for that, Doctor Jason Lagott. Would you like to add anything more?
No, I think that was explained very well. Thank
Okay.
you very much.
Okay, thank you. Aaron?
Okay, so to follow up on that, we've also heard that there's been talk that the COVID vaccine will be a bit like the flu vaccine, meaning it'll have to be administered every year. Is this true, false? What can you add?
I can also answer that question. That is the model that is actually being looked at. Not only that it's going to be a seasonal vaccine because of the variants. The vaccines that have been developed, let's say 6 months ago and being in production, that's when they backtrack. Okay, that was studied in the United States, in South Africa, in Brazil. What is the circulating variant at this time of the year? Just like the flu, with genetic sequencing monitoring, they'll be able to say that this is the booster shot that you need, and there may be an annual boosters depending on what variants are circulating in the community, and it may be different from one geographic location to another. So, and that has yet to be decided. Remember, these vaccines have just been rolled out in the last 3 to 4 months, and maybe earlier in some of other countries. So the experience as we speak, there's the data are being collected, and there are going to be more definitive answers in the near future. But that's the model that's actually being looked at right now.
Right, and just to add from a public health point of view, I think that really just exposes I would say the bigger underlying problem, which is vaccine hesitancy from the population. If we foresee, for example, that we will need people to receive COVID-19 vaccines regularly, it could be on an annual basis, shorter or longer, we really have to address this underlying hesitancy of people to vaccines in general, regardless of if it's for COVID, for measles, or any other disease. I think the anti-vaccine movement has really grown significantly, not just in the Philippines, but in many other countries. And whilst most of it, if I may say, is based on a lot of presupposition and not really hard facts, the reality is that a significant number of people follow the movement and adhere to all of the different thoughts and principles that they stand for, notably to be anti-vaccines. So it goes back to having that conversation, really understanding why people are afraid of vaccines in general, being ready with facts, certainly, and information, and having forums such as the one you're organizing today, so that people have an opportunity to speak with people such as Dr. Paez, our government leaders, and be reassured that we are looking out for their best interest, and if there are legitimate concerns, that we can help address those.
And let me just add to that too. Remember, we're not just in the early phase of pandemic. We're already it's been more than a year. We have real data to support this. How many vaccines have already been rolled out? We do have that. Of course, it's not 100% safe. There's no 100% safe vaccines, nor 100% effective vaccines. But in general, they are very safe and very effective. So, and these are real data. It's not just like clinical trials. So I think being abreast with current information and being informed is very, very important, and getting it from the right sources.
Well, great. Thanks for those inputs, doctors. Yancy?
Okay, so we have another question. So does the government have a virology department? So if so, who is our expert in handling control and prevention on stopping the spread of the coronavirus that causes COVID-19? This can be answered by like the government officials, maybe.
We have the RITM, the Research Institute for Tropical Medicine. That's the top line government agency handling study of viruses, and they are in the forefront of research, and they were the ones who first administered the COVID test during the first 2 months, when the private hospitals were not yet were not capable of administering it. So there is a bill in Congress presently to establish like a Center for Disease Control, like in the United States. So maybe that is a good step forward to add our capability on research. Thank you.
Senator Pangilinan, would you like to add anything? No. Okay. Aaron.
Yeah, that proposal, the bill is also with the Senate, and I understand that is also going to be heard by the committee.
Thank you, Senator. Thank you, Congressman.
Maybe, Yancy, just to add, speaking on behalf of the Philippine medical and scientific community,
Yes,
we do have, let me reassure everyone today, we do have enough local experts. They are working in different offices and different capacities, many of them working in the RITM, some of them with the Department of Health, and some with the National Institutes of Health in our various different specialized centers and hospitals. So just to reassure everyone that in terms of local capacity, we have enough scientists, physicians, and experts who have been trained, have a lot of experience with vaccines, people working in the Philippine Vaccine Foundation, for example, to expertly evaluate the global data and come up with expert consensus for recommendations in the Philippines.
And I would like to echo that. Many of them, infectious disease physicians and researchers, it's really just a small community of scientists and practitioners. I mean, some of them are my friends as well, working over there, so I really trust them. That they're really on top of all these things.
Thank you very much for your inputs on this. Aaron, next question.
Yeah, so this next question is more directed towards our government officials. So when it comes to widespread vaccine rollouts, we were just wondering, do the people have a choice of which vaccine to get?
Cool. Well, based on our debates before we passed the law in the Senate, the intent really is for the citizens to be able to choose from precisely why we have several purchases: AstraZeneca, Novavax, Pfizer, Moderna, Sinovac. So that should be the ideal. And especially since the FDA itself has provided some recommendations as to who may use or certain clarifications. For example, the FDA, the position of the FDA is that Sinovac should not be administered to anyone above 59 years old, or for frontliners who are high risk, who have high risk exposure to COVID-19 patients, precisely because the efficacy is 50%. Although you have a 100% efficacy in terms of preventing serious illnesses with Sinovac, you don't want your frontliners to just have 50% efficacy, and we support that recommendation. So yes, they should be given the option of choosing which. But having said that, I think the government must continue to convince and persuade and inform the public that all these vaccines are safe, and therefore you don't really need to choose. You can if you wish, but the successful vaccine rollout, as we said earlier, requires a no-nonsense information, confidence-building dissemination campaign to be able to achieve that. And there's just a quick question about the cost. Government actually is committed to paying for the vaccines. The citizens need not shell out money to be able to purchase this, at least the herd immunity of 70 million.
Okay, so thank you for that. We just wanted to expound upon the cost subject around this topic. So we are aware that the concerns regarding this subject are not just about supply, but also about the cost per vaccine. So how much should we expect to pay for the vaccine? How is the government going to help citizens pay for 2 vaccine shots? And how does the government plan on distributing the vaccine to the marginalized?
Yes, the policy of government is that these vaccines to be rolled out should be free. It is government. That's precisely why we have an 82.5 billion peso budgetary appropriations, which can actually purchase, according to the IATF head, about 150 million doses. So enough to be able to achieve herd immunity. So the end, if there is a need to purchase more on top of the 150, the government has at least committed to providing 100% eventually. Well, the immediate target is to get the herd immunity of around 60 to 70%, and that's what we have funded. After which, if there is a need for additional funding to cover the rest of the population, but of course, the rest of the population includes a huge chunk of youth and children who are at this point not yet. There is no recommendation that they be vaccinated. So the 70% herd immunity covers all those 18 years old and above, and therefore the vaccines will be free.
Thank you for that, Senator. Congressman Aglipay, would you like to add any more information? Okay, thank you. Aaron?
Well, unfortunately, our time's almost up. We're really sorry if we couldn't get to your questions. It's a shame to interrupt what have been such great conversations. So we're just going to ask a last and final question, which is, what are some future scenarios that you have for the pandemic in terms of economy, health, government, etc.?
I'm sorry, I was reading one of the greetings in the chat. I didn't get the question. Go ahead. Can you repeat
Yeah,
it?
no problem. So what are some future scenarios you have for the pandemic in terms of economy, health, government, etc.?
Well, we've said this before, and that's precisely why we pushed for that vaccination, comprehensive vaccination measure. That a successful vaccine rollout, as well as effective testing, isolation, and treating, and contact tracing, are not twin, there are several options, but are a combination of interventions necessary for us to be able to regain the confidence of our citizens. Right now, our citizens continue to live in fear, precisely because of the surge, 7,000 cases yesterday. And if there is fear, they will not go out, they will not spend, they will not participate in gainful employment, or will be unable to do so. And so the economy will continue to be struggling and contracting. So the economic recovery is based on a successful, or is hinged on a successful vaccine rollout and management, effective management of the spread of COVID. And this is what we have to continue, at least in the Senate and in the House of Representatives. We have a a system of government wherein there are checks and balances. So we have to continue to, the term is kalampagin, ang executive department to push and push to ensure that they meet their targets. The target, by the way, is there has to be herd immunity or 70 million of our population vaccinated at the latest first quarter of next year. So 1 year from now. If we achieve that, and coupled precisely with meaningful and effective contact tracing, testing, then that is the key to economic recovery and normalcy. And that's what we have to keep pressing, whether private citizens or government officials.
Thank you, Senator. So we have the final follow-up question regarding this discussion before we move on to the end of the webinar. So the question is, what are the best case and worst case scenarios for the length of the virus presence in the Philippines? Does anyone like to answer? It's directed to like everyone.
Maybe Dr. Ligot can weigh in on
doctors
that.
respond first.
Okay.
So that is a question that we're asked more often than you think. And unfortunately, I really don't have a crystal ball. And I think, if anything, this pandemic has taught us that you can't predict what's going to happen. In fact, there are entire departments in the World Health Organization, where I also work, that are devoted to studying future risk to pandemics. So that gives us some measure of, some pause, I think, for reflection that, yes, the last time we've had a public health emergency of this magnitude was over 100 years ago, when I don't like to call it the Spanish influenza, because that's particularly stigmatizing to Spanish people, but the 1918 influenza, let's just put it that. And really, between that and COVID-19, we've had pandemics, but not to this proportion, but it has happened now and again. So this will not be the last, unfortunately. But the takeaway there, I think, is that we should really invest in our systems, in preparedness, because as we can see, a lot of our actions are really determined by the capacity of our systems. And by systems, it's not just government, it's citizens, private and public sectors working together to respond in a coherent and strategic way. So if you're asking me when the pandemic is going to end, unfortunately, I really can't give you a specific answer. However, I totally support the message of Senator Pangilinan. It will require a combination of different factors, both addressing the public health emergency, but also the very real economic emergency that we have right now, for us to find a way forward.
Hello. In ending, my message is that this will take a whole of nation approach to this problem. As said by Dr. Ligot, the last pandemic was 100 years ago, but during that time there were no airplanes yet. So now the airplane transportation made this virus spread in just weeks. So the problem is, I think, 100 times more complex than it was 100 years ago. So now, coming back to the whole of nation approach, I think it starts with us. I don't want to put politics in, but maybe in the next 18 months, we should discern who our leaders will be for the next 6 years. If we want the same way it is handled now, then I guess we have to do, as leaders and as citizens, we need to follow our present leaders, but it doesn't mean that we have to live with it for the rest of our lives. With regards to the economy, I think the best case scenario is recovery for the economy will start 2022. And the worst case scenario, we will have a negative growth rate. Last year, it was negative 9.5%. The worst case scenario is, I think, until 2024, we will have negative growth rate. Only recovery would start at 2025 if we don't, as Senator Kiko said, take care of this immunization program and make it work and make it successful, then we can achieve herd immunity. But if we're not disciplined, not only the citizens, but all of us, from the leaders to the private sector, the government, then there is a problem. And our recovery, both in a health aspect and the economic aspect, will be very long. Thank you.
Just some parting words. So I would like to say that we know more about the science of COVID-19 now than before. So I think we should look at the data of those models that have worked. We should look at Israel. We should look at, for example, UK, how they were able to control, the surge with vaccination. There are several things that you can learn from other models. We know that physical distancing works, washing your hands, face masking, and of course, we do have effective vaccines and safe vaccines. So I think, we know the reason why we're doing this, but we just need to put our act together and put resources in order to accomplish what we want to accomplish.
That's right. Just very quickly, again, I actually answered the question already earlier. We cannot afford to have a ineffective vaccine rollout, and that is something that has to be pushed not just by those in government, but also in the private sector. We also should precisely learn from the lessons of other countries: Israel, UK, Vietnam, Thailand, Taiwan, New Zealand. Taiwan only has 10 deaths in the last year, 998 cases. If a country like Taiwan can do it, there's no reason why we should not be able to perhaps not match it, but not be far behind. And therefore, we should be able to do it. And I agree with Congressman Mike. The 2022 elections is 15 months from now. If we're, and a lot of this has to do with effective, competent leadership. And if you believe, that incompetent and effective leadership, then use your persuasive powers either to vote for or support candidates who you believe can effectively help manage this pandemic that we are currently facing. And again, in the end, let's not lose hope. If other countries can do it, so can we. But we just have to precisely come together, set aside our political differences, and focus on solutions. Focus on solutions and demanding solutions to address the challenges of the COVID pandemic.
Thank you for that, Senator. Dr. Ligot, do you have any closing remarks, maybe some final words?
No, I think just like to say thank you again to Beacon Academy for this invitation. I think this has been a very enlightening morning for myself. I learned a lot from my co-panelists, so thank you very much, gentlemen, for sharing your insights and your thoughts. We're still in this together. I think that's the main message from me. And whether we succeed or fail, it will be up to all of us working together, supporting each other in government and all the other sectors that have a role to play in this pandemic response. So a good morning and a good evening to Dr. Paez over in the US.
Good evening too.
Well, thanks so much to everyone for all their great inputs throughout this whole talk. I believe everyone watching has really been able to take a lot away from the great conversations that have been had. And before we hand over the stage to Sir Roy, our MYP coordinator, for some closing remarks, we'd just like to quickly take another last photo now that everyone is here. So please, everyone, if you could just turn on your cams for a moment. Okay, everyone, smile. Okay, that should be good.
Maybe call on Sir Roy for the closing remarks.
Thank you, Aaron and Yancy. Once again, I'd like to thank everyone, our students, teachers, staff, parents, and guests for this very interactive and informative session. Definitely, we know more now than before. We have experienced a lot, but the fight continues. Thank you to our esteemed resource speakers, Dr. Paez and Dr. Ligot, for enlightening us about the role of vaccines in activating our immune system, how it offers us protection, its process of development, and what herd immunity is. I personally hope we can reach that critical number of immune individuals soon. Thank you, Senator Pangilinan, for giving us a balanced evaluation of our current situation. With a common problem in COVID-19, I do hope we can really emerge as a nation with a shared purpose. And I agree that we can learn from the experience of successful countries. Thank you, Congressman Mike Aglipay, for sharing to us the status and plan of the government in the vaccination program. I am quite relieved that we are aiming to vaccinate 70 million individuals by the end of the year. So that's more or less the number of individuals needed for herd immunity. I hope that tripartite agreement also works. Lastly, thank you Yancy and Aaron for a wonderful hosting job. And of course, the entire grade 10 students, Imperium Strong. You did a wonderful job organizing and spearheading this service and action event together with Miss Patty, the service and action coordinator. Indeed, you are able to raise community awareness. Finally, whether you have been vaccinated or not, and considering the rise of COVID cases daily, we hope everyone continues to practice proper sanitation, wear masks, stay home, and at the very least, practice physical distancing. Stay safe and healthy, everyone. Congrats again, grade 10s.